now, and you should all see my screen now. Um, so just want to, okay, so I want to take a second and say that this has been a long time coming, and I'm very excited about this. I know someone else on the call is very excited about this as well. So everyone owes a big thank you to Sheldon for really kicking this into gear and pushing us to get a better way of doing data entry. I have a feeling you're going to find this to be really easy. It's going to flow so much easier than the Excel spreadsheet, and I think you're probably going to actually like data entry this time around. So yeah, let's see. Got a couple of questions, so I'm going to have Mary just field questions. So I have everyone on mute per usual because I'm getting a lot of feedback. So if you have a question, please type that in. Mary's going to field those questions for me. But we'll go ahead and get started. So at the end of the survey, I'm going to send everybody a link to this web page that you're looking at right now, and up at the top it's going to say Test 2015 PIT. So you'll know that this is just a test, and it'll be easy for me to tell who's testing out the SurveyMonkey. This is going to follow the survey pretty much to a T. So let's just go through it. I've got a survey in front of me. If you want, if you have your surveys too, you can go ahead and look at that. But let's just fill this out as if we were doing a survey, and let's just, all right, so the first three questions, are mandatory. We need to know the person conducting the survey, we need to know the city, and we must know the facility or the street address where you're conducting the survey. And these are mandatory because everybody's going to be filling this out, and we need to go in and we need to be able to pull your surveys from your particular community or your coalition. So if we were to get any back and it didn't have a city, we wouldn't know where that belongs. So these, you can't move forward unless these are filled out. So they're all filled out, and we're going to hit next. All right, and so this is just like the survey. The individual did not want to take the survey, but our individual is going to take the survey, so we don't need to do anything there. And let's just go ahead and start filling out some information for our fake individual. And again, on the survey, you know, we have the date of birth and we also have age, and it's really up to you. Just capture one of those. I mean, if you have both of them, that's fine, but you really only need to enter one. We're okay with just one of those. So we'll go ahead and fill this out. And you'll see that these questions are in line just like the survey, and and they're even pretty much set up just like the survey too. So you have two options over here, two options over there for each category. So you'll see that it's set up just like the survey, and you just need to go through and pick your choices. And the great thing about the SurveyMonkey is that it has skip logic. And that means, so let's take a look at this question. When we ask the individual to describe their family or their household staying with them today, you know, not in the future or not last week, but today. So we have all of these different options. Now, if I were to choose I'm a single individual, and I hit next, that is going to eliminate a question that would only be asked for households with children. So it's pretty nice that you wouldn't have to answer those questions or even skip over those questions. You just don't even see them. But for this particular person, let's go ahead and say that they are a one-parent family with children. And so then this takes us to a question that relates to the child or children in the household. And let's just say that this child needs care. You hit next. So one thing that you're going to notice on the new survey, and I've recorded a webinar about the 2015 survey, but for some reason when we put it on YouTube yesterday, the audio wasn't there, so a couple of us in the office are trying to figure that out, but it'll get there, don't worry. This question is the same question as previous years. The only difference is we've actually spelled out here the different branches, and this is from HUD. So if this particular person says that they have not served in the United States Armed Forces, and we hit next, it's automatically going to ask whether or not they were activated into active duty as a member of the National Guard or as a reservist. Now, this isn't a mistake on our part. It's HUD, and they really want us to try and capture as much data on veterans as possible. And the thinking behind this is that some members of the National Guard and the reserves will not automatically say that they were a member of the United States military. So this is just a way to kind of double check that and to make sure that the answer is actually no. So no matter what your answer is, you're going to see this, and so you're going to think, hey, I just said that this person wasn't a member of the United States military. Well, HUD's just trying to make sure, and we're just trying to capture as much data on veterans as possible. So that person was not a member of the military in any form or fashion. So then we move on to whether or not this person is currently homeless. And let's go ahead and hit yes. So now what we want to do is the next questions right on the survey. What best describes your current situation? Let's just say this is the first time in the past 3 years. And then how long has this current episode lasted? Let's just say it's lasted 4 months. And this is also a new question for 2015. It's been on previous surveys, but it was not on the 2014 survey. What city were you living in when you became homeless this time? So let's just go ahead and say Austin. And besides this time, have you been homeless another time in the past 12 months? Let's just say no. So we hit next. So on this question, are there additional members in the household other than the person taking the survey? So what you're going to want to do, and I'm going to pull up the survey here, and this is where you get that answer. If you've got folks in here, then you hit yes. If all of this is blank, if this big table right here is blank, you would hit no. So, and then we also want you to fill this out. So this would be the total number of adults and then the total number of children. If it's just the one person taking the survey, you would just put 1 right here. And, but if there are other adults in the survey, then you just add everyone up, put that there. But the reason we have this question here is because you're able to skip a whole bunch of questions if you need to, which is nice. But this person has actually an additional member of the family. So you've got 1 adult. Let's do 1 kid. Okay, so this is for additional member 1, and again, you're going to see up here, this is not the head of household information, this is additional family member. And let's see, Mary, I assume you've got the questions that are there. Okay, all right, so we're just going to say child And yeah, let's do this. These are all the same questions that were asked of the head of household. Okay, so the only thing here that if you do have additional members of the family, it can't really tell how many you have, so the skip logic, and I really tried to do this, but so you're just going to have to keep hitting next, unfortunately. The good thing is that you don't have to do this if there's only one member of the family, but it just takes a couple of seconds. So here we go. In the past year, have you needed medical care? So this is really nice. I like the SurveyMonkey portion of this because in the past we would see that people would answer no, they did not need medical care, but then they said that they would receive medical care, and they received it at a whole bunch of places. But you know, the thinking is if you actually received medical care, there's probably a reason that you needed it. So this is good. The SurveyMonkey will do skip logic here, and so if we say that yes, you did need medical care in the past year, were you able to receive it? And let's say that this person did receive it, and then let's find out where this person received medical care, and let's just say emergency room. That's the most common answer. And in the past year, did you need dental care? Yes. And were you able to receive the dental care you needed? Most common answer for dental care, unfortunately, is no. So then we move on. Did you need mental health care? Let's just say no. And did you need substance abuse care? Let's say yes. And were you able to receive substance abuse care that you needed? Let's say yes. Okay, and let's find out where this person received it. Let's say social service agency. We'll hit next. Any HIV or AIDS care? Let's say no. And okay, so here we go, and we're getting toward the end of the survey now. So this is a check all that apply. Why did you become homeless? So let's see, we'll just click some here. Highest level of education, of course this is check 1. And then are you able to work? Yes or no. This person is able to work. And so let's get the job status here. This person is unemployed. So since we picked unemployed, we want to know how long have you been unemployed. Let's just say this individual has been unemployed for 6 months. Hit next. Okay, which of the following services do you need? And let's do the most common ones here. All right, and we'll hit done. Hey, and that's it. That's all you have to do. And so the great thing is we have the data entry instructions on our website, and so that there's a link there, and what the instructions tell you to do is go ahead and bookmark that, because once you get to the end of your survey, you just go back to your bookmark, click on that link again, and then fill out your next survey. But I'll let you get that on our website, because the link that I'm going to send you is actually just a test link. So we don't want a whole bunch of people actually filling out the actual point in time SurveyMonkey survey. I really just want you doing the test survey, so we don't get confused with the entries that are coming in. So I'm going to send you an email as soon as we're done here with the test link, and if you want, feel free to print up a survey, fill it out, and go ahead and put it into the SurveyMonkey. But that's it. So there's no more Excel, there's no more one for this, one for that. Just go ahead and fill it out. It follows the survey really well. I've tested this out on a couple of people in the office, and they're still alive. Everything seems to work well. So if you would, please, if you could find, 15, 20 minutes this week to do that, let me know what you think. Let me know if there's a question, something that could be changed. We did you know, Mary, I actually tested this out on Mary, and she found it to be pretty easy, and she can tell you more about that. But that's it. So let's go ahead and open this up to questions. So I don't know, Mary, how do you want to handle this? Because I know you're looking at questions too.
Yeah, I can go ahead and read the questions that we've
Yeah,
gotten.
yeah, that would be great.
Okay, I just finished answering one. We have got a caller, or an asker, who said they're a first-time shelter director, and they would like to know more about the point-in-time count and this survey. And so I referred them to you.
Okay, great.
So anybody who's on the line who's curious what we're doing here, the SurveyMonkey is for the data entry part to combine all the data that people gather during their point-in-time count. And within our continuum of care, that count will be held on January 22nd, so in about a month and a half. Oh, thanks. And Lindsay, I see you're putting your data on the screen. Lindsay Marsh in our office here at Texas Homeless Network, she's coordinating the whole point-in-time count effort across all of our counties. So if you have any questions about doing a point-in-time count, including anything related to this SurveyMonkey, feel free to contact Lindsay, and we'd love to have as many communities involved as possible so that we can best represent, you know, how many people are out there in our communities who are needing help. Another person asked if this webinar was going to be available on our website, and yes, it is. We have a number of materials related to the point-in-time count already on the website. Could you possibly pull that up, Lindsay, and show them where on our website?
So you're going to go to Balance of State, Continuum of Care, and sometimes yeah, there we go. Just drop down.
You have to use the drop-down box.
Yeah, go to COC Resources, and then you'll see the 2015 point-in-time materials. Now, you'll see the old 2014 survey overview, and as soon as we get that audio situation figured out on our YouTube channel, then we'll put the 2015 one up. It's pretty much just the same as the 2014 survey, but here we have a flyer if you want to download that to hand out to different areas around your community. We have the point-in-time survey in English and Spanish, the photo and video release form, the volunteer info packet and the script. The SurveyMonkey instructions are on here, and then your volunteer and in-kind donation tracker on here as well.
Great. We've just received another question. Are we going to be required to send in the paper surveys?
So that's a really good question. As you know, in the previous years, we've asked you to send those in, and the main reason for that is I would have to clean up the Excel data, and oftentimes I would need to go and pick out a particular paper survey and see if it was filled out correctly and look at that, and that's why we had to have those sent in to us with numbers on the top. So for right now, what I want you to do is just hang on to them. If you could put them in a folder somewhere with a big binder clip, just hang on to them. I don't think that we're going to need them, but just in case, hang on to them, okay?
Yeah, and so I have a question myself. Lindsay, I think when we were doing this, we were talking about this SurveyMonkey survey that you just went through. Mm-hmm. As the way that people would transfer their data from a paper survey mm-hmm. into an electronic format that can be really easily sorted and analyzed and reported out. Right?
Right.
Okay. But as you were going through it, I wondered, can people be filling in the SurveyMonkey survey in real time? As they're interviewing someone, like rather than using the mobile app,
sure.
Could their
So
Yes.
the nice thing about the mobile app is that you don't have to be online. But
Ah,
if you take the SurveyMonkey, you would need to be online. So there would need to be Wi-Fi service or some sort of 3G, 4G um, uh, um, service available. Or if you're at a shelter, you could definitely be sitting at your desk with your clients in front of you and filling it out that way. So, it's kind of up to you what you want to do as far as that's concerned.
okay, so I'm envisioning a diagram that is sort of sketched out. If people, we're really offering 3 ways that people could actually conduct the survey and gather the data, and that's by filling out the paper survey form or using the mobile app, and they don't need to be online for that, or entering the data directly into SurveyMonkey, but they would need to be online for that.
Yeah, and I mean, having the paper survey in front of you would probably just be easier even if you're sitting at your desk with a client in front of you.
Mm-hmm. All right. It's just, I think we're using the word survey a lot, and I want to make sure people understand that there's the survey that with the questions that you're going to be asking each person, and then there's this SurveyMonkey survey where you do your data entry.
Mm-hmm.
Okay. Let's see. I think we got one more question. For clarification, will we be required to input rather than send it to HMIS to input?
Let's go ahead and hold on one second. Dawn, I'm going to unmute you so you can explain that question a little bit more. So hang on one second. Okay, Dawn, you're unmuted if you want to ask your question.
Okay, I've just never did the data entry. I've always sent them in, so now I will input them is what I'm hearing.
Yes, this is the,
Okay.
yeah, absolutely.
Okay. Thank you.
Yeah.
Yeah, I think in the past what THN has had people available to do the data entry, but as much as possible we really would like that to be done on the community level. And I will say, Lindsay told you guys I tested out the SurveyMonkey survey, and it was very, very quick for me to go through the paper survey and just answer, put the data into the SurveyMonkey survey from the paper survey. So hopefully, again, the part of the point is that we're not trying to enter it into complicated Excel spreadsheets anymore. It's a pretty simple, just, click the answer circle for each of these questions. So the data entry part hopefully will be much quicker on your end as well.
Okay, looks like there was another question there. Can we have multiple people entering the surveys that they completed rather than one person as last year? Yes, and just for clarification, you could have multiple people entering on an Excel spreadsheet. You would just need to copy the spreadsheet and then copy and paste everything into one. But yes, everybody has the same link to the SurveyMonkey data entry. So the way that we're sorting your surveys is by city. So so when you're done with that, whoever your point-in-time contact person is needs to send me an email and say, hey, Lindsay, all of Lubbock is done. We covered the city of Lubbock, and we also covered these other small cities as well. So I need to know all of that. And if I find that there's a city in there that doesn't really fit, but it's in the same area, I'm going to ask you, hey, did you have anybody named Martha doing data entry for you? And if you say yes, then I'm like, okay, great, this goes with you. So It's really, really important that the person enters their name, that they're the one filling this out, and the correct city.
Yeah, Lindsay, was the one person, or Sheldon, the one person, was that just to try to catch or not allow multiple people to enter data, just so that one person is the same consistently entering all the data in the same way, like less chance for data entry enterer error, data enterer error?
Mary, do you have the ability to unmute him?
Oh, I don't know. I don't know how I would do that.
Okay.
I
Hold on
see
one
his
second.
name in the questions and in the attendee.
Yeah, you just...
Oh, yes, I do,
Okay,
actually.
great.
Guys, Lindsay gave me some new tools over here that I'm not completely familiar with, but hello, Sheldon. You're unmuted now. Sheldon, are you still with us? I see he wrote in just wondering about how much flexibility we have, and thank you for this change. And he's micless, he says, so he's not able to speak, but he's typing in, thank you for this change. All right, you're welcome. And Lindsay, those are all the questions I see.
Okay. Anyone else? All right. I mean, if you want to go back to the Excel, you can, but don't do that because this is much easier. So, yeah, if anyone has any questions whatsoever, let me know. I'm actually going to be working from home for the rest of the day. I've got a sick kid, and I appear to be sick as well. So, yeah, so I'm going to be, I'll be at home, but I'll be available via email, and my email address actually has my my cell phone number, so you can always get in touch with me. And we'll get the YouTube thing sorted out, and if I need to record it again, then I'll go ahead and do that. But it's pretty easy. So again, fill out your paper surveys, have your volunteers fill them out. You know, a good thing that we talked about with the point in time setup and implementation with our webinar last week is that have your volunteers read through all of the questions and answers. That's really, really important, and it'll save them time as well. So yeah, go ahead, take a look. I'm going to email you the test link right now, and I think that everyone's going to find this to be really easy. It's going to be easy on your end. It's going to be easy on my end, and the margin of error is going to go down, which is always fantastic. So, so yeah. So if there aren't any more questions, and Mary, do you have anything else to add?
Just one thing. Are you having a makeup session
Yes.
for filling out the paper survey?
Yes.
And when is that
well,
again?
it's not filling out the paper survey. It's the planning, how to plan for the point in time count.
Right.
And so that's going to
Okay.
be tomorrow, and everybody should have gotten an invitation for that. If you haven't, you need to let me know or check with somebody else in your community because somebody should have gotten that invitation. And I believe it's either at 1 or 2 o'clock. But yes, it is tomorrow, and we'll be doing a makeup of that for the folks who weren't able to attend. And so far, I think we've got about 8 people signed up for that.
Great.
Okay, if there aren't any more questions, then I will be talking to some of you tomorrow.
All right. Thanks, everyone.
All right, folks. Bye-bye.